I'm Dr. Balaji Jaganmohan. I'm a practicing diabetologist at the Apollo Sugar Clinics at Padmanabha Nagar and JP Nagar in Bangalore. Today I'm going to talk a little bit about hypoglycemia, which is also known as low blood sugars, which can be seen in most of the type 1 as well as type 2 diabetic patients. So what is hypoglycemia? Hypoglycemia is a condition that is seen in response to medications that are taken either by type 1 or type 2 patients. In type 1 patients, as we understand, they are taking insulin and they have to continue insulin lifelong. So when a patient is taking insulin, he or she is prone to low blood sugar or hypoglycemia. Similarly, for a type 2 patient as well, they might be on anti-diabetic agents or they might even be taking insulin. So they are also prone to hypoglycemia. Hypoglycemia is a condition where the blood sugars would drop below 70 milligram per deciliter, and the patients would experience certain symptoms of hypoglycemia which occurs at a blood sugar level of around 55 milligram per deciliter. So what are the symptoms of hypoglycemia? The patients might have giddiness, they might have sweating, their hands and legs will shake, what we call tremors. They'll feel very hungry and the heart rate will increase. So these are all some of the symptoms that a person might experience during hypoglycemia or low blood sugar. The immediate measure a patient should take when he or she gets hypoglycemia is to immediately eat something. Ideally, any carbohydrate in the form of a liquid juice or a drink would try to restore a normal blood sugar and correct the hypoglycemia. Sometimes if the liquid carbohydrate is not available, then they might have to take something that is solid in nature. Try to avoid taking chocolates because chocolates have a higher content of fat and that might take a longer time to correct the hypoglycemia. Any candy would be an ideal way of correcting hypoglycemia and restoring the blood sugars to a normal range. So in order to diagnose hypoglycemia, there are three things that are important, three characteristics. One is the symptoms that I have already mentioned. The second is a documentation on a glucometer. So every diabetic patient who is ideally on insulin or taking drugs like sulfonylureas should have a glucometer at home so that we can monitor and document the presence of hypoglycemia. So on a glucometer, when they have the symptoms, if they check it and if it is less than 70, then that is explicable for hypoglycemia. The third is they have to eat something, like I said, a carbohydrate in order to correct hypoglycemia. Now, certain individuals are more prone to hypoglycemia. Who are these ones? They are elderly patients, they are patients who have chronic kidney disease, they are patients who have any form of liver disease, or patients who are undertaking any form of fasting. It can be a Ramadan fasting or any form of religious fasting. So these are the groups of patients who have to be watchful of hypoglycemia and they have to take the corrective measures of eating something to correct the hypoglycemia. But at best, one should try and avoid hypoglycemia. If you get any of these symptoms, try to report it to your treating physician. Then the necessary measures in terms of trying to reduce the insulin dose or trying to reduce the dose of sulfonylurea can be done appropriately so that we can try and avoid hypoglycemia, because hypoglycemia can be more lethal than a hypoglycemia. Now within hypoglycemia, you have a minor hypoglycemia where you have the symptoms and it can be corrected. And then you have a major hypoglycemic episode, what we also call as neuroglycopenia, where the blood sugars can go below 30 milligram per deciliter and the patient might fall unconscious and might require a third-party assistance of another person taking him to the hospital where an intravenous glucose has to be administered. So be watchful of hypoglycemia and try to avoid and take the necessary measures to correct it. Thank you.